As we get older, women especially, your body changes and you may start to notice a little extra belly fat, even if your eating and exercising habits really haven't changed.
I feel like that was written for me. It could actually be part of the problem. Dr. Mary Claire Haver is a board-certified OBGYN and culinary medicine specialist, and she's joining us to help women beat the battle of the bulge in midlife. Nice to see you, and thank you for joining us today.
Thanks for having me.
Yeah, this is one of those conversations. So let me ask you this, first of all, why does belly fat seem to just kind of grab a hold of us in midlife or around those ages?
Sure. So for most women, we tend to gain weight about our hips and thighs, giving us curves, you know, in places we like it. But as we get through the menopause transition and middle age, as our estrogen levels begin to fluctuate and decline, we start seeing new depositions of body fat in the intra-abdominal cavity. In medicine, we call it visceral fat. We all call it belly fat at home.
Yes, we do.
But suddenly your midsection is expanding and you're not really doing anything different.
Right. Okay, so what are some health risks actually associated with extra belly fat, and how much is too much and what's kind of normal?
Sure.
Yeah.
So as our intra-abdominal fat increases, the risks for lots of inflammatory diseases increase, like hypertension, diabetes, stroke, neurological disease, and sudden death as well. And so there are different measurement options to measure. So if you have a DEXA scan, it's an easy way to tell you about your level of visceral fat. But there's really a quick and easy way you can do it at home.
Okay.
And so
Pinch it.
it's called the waist-hip ratio.
Okay.
And all you need is a tape measure and a calculator or a back of the envelope to do it. And so you take the smallest measurement of your waist, whatever that is, and if you don't have a tiny waist, you can just use your belly button, and then the widest part of your hips, and you divide those two. If that number is less than 0.7, you probably don't have an excessive amount of visceral fat. If it's greater than 1, more than likely you do. And the visceral fat measurement has been shown to be a more effective indicator of chronic disease risk than your weight or your BMI.
Oh, wow, that's so interesting. I wish we had a tape measure now. Maybe I don't know. So obviously we want to get rid of the belly bulge, and you have 5 ways to slim down and feel healthy. The first way, you're talking about getting enough fiber. It's important, but why is that so important?
So fiber does a lot of things for our body. Women who consistently get above 25 grams of fiber in their diet per day will have decreased visceral fat over women who don't. So fiber feeds our gut microbiome, which, as we're learning more and more about today, is so important to keep your gut healthy. It also slows down the rate of absorption of glucose into our bloodstream, therefore lowering your insulin levels and lowering inflammation. And foods that are rich in fiber also have lots of vitamins, minerals, and nutrients in them as well.
Okay, so your next tip, we need to limit our sugar. So hard for me. Why is that a big deal, and how do we go about measuring it?
Sure. So added sugars, as it turns out, there's sugar present that I say God put in food. So that's
Fruits.
naturally occurring sugars in fruits and vegetables. I'm not talking about those. I'm talking about sugars that are added in the cooking and processing process of, you know, as we create food and drinks. The #1 source of added sugars in the American diet is going to be soft drinks, coffee drinks, you know, these lovely treats that we give ourselves. Fortunately, since 2021, this is on the labels of packaging. So it's pretty easy to track your added sugar content. So limiting those to 25 grams or less per day, women who do that in midlife will have less visceral fat than those who don't.
I'll be curious to see if putting those labels has helped in any way, you know, like 5 or 10 years reduce, you know, people like think twice again.
You're just you're more aware. You flip it over and, you know, condiments, drinks, really looking and saying, wow, I had no idea that that much was in there.
Yeah, I mean, you have no choice but to believe it at that point. Like, it's all there. Let's talk about exercise and the best type of exercise for women in this stage of life.
I get lots of questions about that, and there's not an easy answer. We exercise no more to be thin. That should never be the purpose of exercise. We exercise for a strong mind, for a strong body, muscles, and bones. So we need cardiovascular to keep our heart strong. We need resistance or strength training to keep our bones and muscles strong. And we also need to stretch.
Yes.
And balance, so important to maintain our functionality as we get older.
Yeah, it really is, and you notice it, especially, my dad's 83 now, so I notice that balance is really important to focus on, you know, so you don't have falls.
Let's talk a little bit about stress. We all deal with it differently. What are some ways that can contribute to?
So stress reduction, or stress in and of itself, however that manifests, you know, in your life, increases our cortisol levels. And as our cortisol level goes up, it wreaks havoc throughout our body. body. It leads to inflammation, increasing blood sugars, and driving more and more fat to the belly. And so stress reduction actually just looks different for everyone. For you, it might be prayer. For you, it might be exercise. For someone else, journaling, meditation. Just looking into your life. What is it going to take for you to take that time for yourself where you can shut the world out and do something just for you?
All right, and I know number 5 is alcohol, and you mentioned that because of the sugars that are in alcohol. That is
Right.
All right, Dr. Haver, it's so good to see you. Thank you so much for joining us today.
Thanks for having me.
And of course, if people want to know where to find you for more information and tips or how to stay healthier in midlife, you can always visit Dr. Haver's website or follow her on Instagram as well. The information right there on your screen.